Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss, can you smoke Xanax? Xanax is a prescription drug used to treat anxiety and panic disorders. It belongs to a class of drugs called benzodiazepines, which are known for their calming and sedative effects on the body. While Xanax is usually taken orally in pill form, some people wonder if it's possible to smoke Xanax. The short answer is yes, you can smoke Xanax. However, keep in mind that to smoke Xanax is not a safe or recommended method of use. When you smoke Xanax, you're exposing yourself to a number of risks and potential side effects. To smoke Xanax has a lot of risks. One of the main risks is that you're inhaling unknown chemicals and toxins that can damage your lungs and respiratory system. When Xanax pills are smoked, they're often combined with other substances such as tobacco, marijuana, or other drugs. This can increase the risk of addiction, overdose, and other health problems. If you're prescribed Xanax, it's important to take it as directed by your healthcare provider. Taking Xanax in ways other than prescribed, such as smoking it, can increase the risk of addiction, overdose, and other health problems. Additionally, Xanax is not meant to be used as a long-term solution for anxiety or panic disorders, and there are other treatments available that may be more effective and safer for long-term use. Some alternative treatments for anxiety and panic disorders include therapy, relaxation techniques, and other medications. Your healthcare provider can help you determine the best treatment plan for your specific needs and circumstances. It's also important to talk to your healthcare provider if you're experiencing any side effects or concerns related to your use of Xanax or any other medication. While it may be tempting to experiment with different methods of intake, such as smoking it, it's important to remember that these methods can be dangerous and should be avoided. Always take prescription medications as directed by your healthcare provider and talk to them about any questions or concerns you may have about your treatment plan. What happens if you smoke Xanax? Smoking Xanax can have a range of negative effects on both the body and mind. While some people may think that smoking Xanax will enhance its effects or make it more potent, the reality is that once you smoke Xanax, it can be extremely dangerous. Once a person smokes Xanax, one of the most immediate risks is that it can cause respiratory problems. When Xanax is smoked, it's often combined with other substances, such as tobacco or marijuana, which can irritate the lungs and cause inflammation. Over time, to smoke Xanax pills can lead to chronic lung diseases like bronchitis or emphysema. If you smoke Xanax, it can also have negative effects on the mind. Xanax is a potent sedative, and when smoked, it can cause extreme drowsiness, confusion, and impaired cognitive function. This can make it difficult to perform everyday tasks or make decisions, and can also increase the risk of accidents or injuries. Another risk of smoking Xanax is that it can lead to addiction. Xanax is a highly addictive drug, and smoking it can increase the risk of dependence and withdrawal symptoms. People who smoke Xanax may feel the need to use it more frequently or in larger doses to achieve the desired effects, which can lead to a cycle of addiction and substance abuse. It's easy to forget that smoking Xanax, or anything at all, can increase the risk of overdose. When Xanax is smoked, it's difficult to control the dosage or potency, which can lead to dangerous levels of the drug in the body. Xanax overdose can cause respiratory failure, seizures, and even death. To smoke Xanax pills is a dangerous and potentially deadly practice. It can lead to respiratory problems, cognitive impairment, addiction, and overdose. If you're struggling with anxiety or panic disorders, talk to your healthcare provider about safe and effective treatment options. Remember, Xanax should only be taken as directed by a healthcare provider, and smoking Xanax is never a safe or recommended method of use. Can you smoke weed on Xanax? When Xanax and weed are used together, they can have additive effects on the central nervous system, leading to physiological and psychological responses. Xanax, or Alprazolam, is a benzodiazepine that works by enhancing the effects of the neurotransmitter gamma-aminobutyric acid, GABA, in the brain. This makes the brain and body feel calmer, which can help reduce anxiety, make it easier to relax, and make it easier to fall asleep. Weed, or cannabis, contains a psychoactive compound called delta-9-tetrahydrocannabinol, THC, which binds to cannabinoid receptors in the brain and body. This can make you feel euphoric and relaxed, change the way you see things, and make it hard to move around. When Xanax and weed are used together, they can have additive effects on these neurotransmitter systems, which can lead to an increased risk of adverse side effects. For example, both drugs can cause sedation, drowsiness, confusion, and impaired coordination. When used together, the effects of each drug can be amplified, which can lead to an increased risk of accidents, injuries, and overdose. Factors that influence how long the effects of Xanax last. Factors that influence how long the effects of Xanax last include dosage. The higher the dose of Xanax taken, the longer the effects will last. Age. Older individuals tend to process Xanax more slowly, which can result in longer-lasting effects. Weight and body composition. People with a higher body fat percentage may have longer-lasting effects as Xanax can become stored in fat cells. Metabolism. Individuals with a faster metabolism may process Xanax more quickly, resulting in shorter-lasting effects. Liver function. The liver is responsible for metabolizing Xanax. If liver function is impaired, the effects of Xanax may last longer. Tolerance. Individuals taking Xanax regularly for an extended period may develop a tolerance, which can result in shorter-lasting effects. Other ways people take Xanax. While the most common and safe way to take Xanax is orally, some people may misuse the drug by taking it in other ways that are not recommended by healthcare professionals. These methods include crushing and snorting Xanax tablets. This method involves crushing the Xanax tablets into a powder and snorting it through the nose. This method can lead to faster drug absorption, but also increases the risk of addiction, overdose, and damage to the nasal passages. Dissolving and injecting Xanax. Some people may dissolve Xanax tablets in water and inject it into their bloodstream. This method is highly dangerous and can cause serious health problems, including infections, collapsed veins, and overdose. Smoking Xanax. As mentioned earlier, it is technically possible to smoke Xanax, but it is not a safe or recommended method of use. Damage to the lungs increases the risk of addiction. An overdose is what happens when you smoke Xanax. Xanax addiction. Some individuals who suffer from anxiety turn to Xanax for relief and support, but unfortunately, some become dependent on the drug. Those who have never abused drugs may start smoking Xanax to improve their symptoms. Some use it for an extended period, sometimes with a doctor's approval, and are unaware of their addiction until it's too late. Withdrawal symptoms that mirror initial anxiety can occur if one attempts to reduce their dosage. Some users believe they cannot function without the drug, and these substance-induced symptoms may continue if drug abuse persists. People may combine Xanax with other downers like alcohol or opiates to increase pleasurable feelings, leading to dangerous health consequences such as coma, respiratory arrest, or even death. Others use Xanax to control unwanted side effects of stimulant abuse. And this combination of uppers and downers can lead to heart problems like myocardial infarction. Prolonged usage of Xanax can result in physical and psychological dependence. While some users initially found relief from everyday stressors, they must learn how to have a productive, enjoyable life without the drug. Many users take Xanax to feel normal and function daily, believing they cannot function without it. These individuals require drug rehab to overcome their addiction and embark on a new, sober life with sober living skills. Signs of Xanax addiction. The signs of Xanax addiction can present themselves as increased anxiety when not taking the medication, going through withdrawals, more intense than quitting caffeine, the development of tolerance to Xanax over time, inability to cut down on dosage despite knowledge of how dangerous an increase in dosage can be, decreased performance at work or school. We Level Up NJ Treatment Center specialists can provide information on dual diagnosis and detox programs to treat Xanax withdrawals. That's it for today. Please subscribe and hit the notification bell. Like, share, and comment. We would love your feedback. Have a great day.